My name is Jen Tinker, and I'm a neuropsychologist at the Comprehensive Epilepsy Center at Thomas Jefferson. And, as a neuropsychologist, what I do is assess thinking skills, like memory and attention and mood. And both of those things are very important in epilepsy because they're often affected by epilepsy. So I'm coming at this from a bit of a different approach where I believe that biological, psychological, and social factors all play a role in epilepsy and men's health. And so we've talked today about quite a bit about the commonalities that affect men and women. And what I'm going to do today is really talk about the effects of epilepsy and hormones, epilepsy and sexuality, and then briefly cover sexuality and anti-epileptic side effects. Dr. Gutierrez did an excellent job of that. And I'm not a medical doctor, so he answered those questions better than I could have. And so really what I want to talk about most is epilepsy and self-esteem, and really give more information about epilepsy and sexual functioning, and make it easier to talk about. The primary message here is talk to your doctor. If you don't talk to your doctor, nothing can change. And there are things that can be done, and so it's important to sometimes talk about what can be considered a taboo topic. It's important to bring these concerns up to your doctor. Okay, and so as we've already learned, epilepsy does affect hormones. The primary male hormone being testosterone, which stimulates the development of male sex organs, sexual traits, and sperm production. And so what we know is that about 40% of men with epilepsy have low levels of what we call bioavailable testosterone, so what Dr. Gutierrez was talking about in terms of the testosterone in your body that is not bound to proteins and it is available. And so that can be for a variety of reasons, one being epilepsy in itself can directly affect brain regions that mediate sexuality, the anti-epileptic drug side effects, and then any underlying brain pathology. What we know about the brain is that our hormonal systems are, in geographic terms, quite close to a lot of the areas of the brain that are most susceptible to epilepsy. And so hormonal changes can impact all sorts of things in our daily life, including our energy level and our mood, our drive, not only for sexual activity, but just to go out and do things on a daily basis, our sexual function, our seizure control, and our bone density, which we've learned quite a bit about today. And so what we know is that men with epilepsy do have reduced testosterone, and particularly related to those older drugs that Dr. Gutierrez was talking about, and lamotrigine seems to have a more favorable profile. And so what's the mechanism of hormonal changes in epilepsy? And the picture on the left is a picture of our brain, the left hemisphere removed to reveal those underlying structures. And you can see the hypothalamus is that almond-shaped structure near the base of our brain. And that's really responsible for metabolic processes and the activity of our autonomic nervous system. And so our autonomic nervous system is in control of our involuntary actions. So things like breathing, digestion, heart rate, all of those things that aren't necessarily under our volitionary control and just happen. And so obviously it's a pretty crucial structure within the brain. And one of its most important functions is to connect our central nervous system to our endocrine system, which in large part is mediated by the pituitary gland, which is essentially protruding out underneath. And our pituitary gland is in control of our body's homeostasis and our ability to regulate things like growth and stress and reproduction. And so the hypothalamus and the pituitary, from a geographic perspective, are quite close to a lot of the regions of the brain that are commonly associated with epilepsy. So you'll see the amygdala there is essentially our emotional center, and the hippocampus is our primary memory center. And in temporal lobe epilepsy, those are things that are affected, and you can see, just from the geographic perspective, they're quite close to each other. And so the brain can have direct effects, as well as when you're having a seizure, it can affect the closer brain regions. And so this is a good time to point out that most men with epilepsy have normal and fulfilling sexual relationships, and that they will deal with issues of sexuality intermittently over the course of their life, depending on medication and a whole variety of biopsychosocial factors. And so what we do know is that 50 to 70% of men with epilepsy report decreased sexual function and or libido, and that in comparison to the general public, they do also report more erectile failure. And so the reason for this, again, is exposure to anti-epileptic drugs, which can have a direct effect on the brain, changes in the brain morphology due to seizures, and most importantly for me as a psychologist, negative emotions. And so depression, anxiety, fear of failure, fear of having a seizure, all of these things play a part. And so one thing that patients often ask us is that they're worried that sexual activity will induce a seizure. And in general, this is quite rare. And so the only exceptions to that is in the case where your seizure is provoked by hyperventilation or strenuous physical activity. What we know about seizure control in epilepsy is that the better your seizures are controlled, the better your sexual functioning is likely to be. And so much like most things, including depression and anxiety, the better control we can get of seizure activity, the more likely that our sexuality will not be impacted. And so, Dr. Gutierrez already spoke about some of the effects of anti-epileptic medications, but decreased libido and sexual dysfunction are a real part of that. The other part of this is that in terms of epilepsy and aging, the most common group to be diagnosed with epilepsy is those over 60. And so as we age, other medical factors can contribute to things like erectile dysfunction and sexuality problems. And so things like hypertension and diabetes all play a role and can be comorbid with epilepsy. And so, this slide focuses on what our most common complaint is erectile dysfunction, and that's the most common complaint we receive. And you'll notice that there are tons of factors that can play a role in sexual performance. Most importantly, things like stress, fatigue, illness, even the common cold or flu can have an impact on our sexual functioning. Excessive alcohol use, fear of failure, low self-esteem, which we're going to talk about more later, feelings like anxiety and depression, previous bad experiences, obesity and age. And so all of these things can affect erectile dysfunction. And then the last three have anything to do related with epilepsy. And so there are a lot of just general health functioning factors that can contribute. And the reason this is important is that beyond epilepsy, each of these is a primary treatment target. If you're having concerns regarding either self-esteem or sexual dysfunction, each of these, you can take a look at your experience in terms of how you relate to stress, alcohol use, etc., to see if there's something else that you can do to minimize sexual dysfunction. And I'm just going to gloss over this a little bit because Dr. Gutierrez already spoke about this, but we know that anti-epileptic drugs can have multiple effects, including decreased libido and suppressing sexual arousal and behavior, sperm abnormalities, reduced testicular volume, reproductive dysfunction related to the androgens and hormonal factors, and then sexual dysfunction. And as we've learned, not all anti-epileptic drugs are alike. Not all have the same effect. And if you're having an impact and you're on one of those older medications, it's worth talking with your doctor. And so I just included these in the slides for your knowledge, but essentially the most common anti-epileptic drugs are listed on the left and their potential impacts are listed on the right. And so that's just so that you can be aware of how your medications might be affecting you. And then this also just limits the potential interactions between anti-epileptic drugs and reproductive hormones. And again, what we know is that the older drugs, phenytoin and carbamazepine, are the ones that are particularly likely to cause sexual dysfunction. And so we've learned all that, but what do you do about it? And I think the first and foremost thing to do is recognize that while uncomfortable, it's important to talk about these things, particularly with your partner. If they don't recognize that you're having feelings associated with sexual functioning or nervousness, then there's nothing to do about it. And if you put it out on the table, it's a lot easier to overcome. Seizure control is vital, and again, this is in terms of mood and sexuality. The better your seizures are controlled, the better you will be functioning in all aspects. Another important avenue is to treat the underlying physical and psychological problems, and we'll talk about mood and how to impact your mood on a daily basis. The other thing is that medications work, and so you know that in certain cases our epileptologists can alter anti-epileptic drugs to improve sexual functioning. There are testosterone replacement options that work to a varying degree. And then there's also medications that address erectile dysfunction. And so these are things that you should talk to your epileptologist about, because they'll be able to guide you in the right direction and with the primary focus on seizure control and managing your epilepsy. Other options include sex therapy and relationship counseling. You know, we've heard from Dr. Schmidt how important sleep is, and as a psychologist, I find myself telling people every day how important sleep is. There's good literature out there that a week of chronic undersleep, so getting just 5 to 6 hours, is as bad for you and your thinking and your mood as an entire night without sleeping. And so if that can happen in 1 week, imagine the impact of chronic sleep deprivation and insomnia. You know, insomnia is something that we all cope with as an adult in our lifetime, but there are things that we can do, including the things we learned about sleep hygiene, that help improve our sexual functioning and mood. And so, you know, the final thing here is health management. Manage your other health conditions so that your functioning is optimal. And so now I'm going to shift a little bit more to something that's more in my wheelhouse as a psychologist, but epilepsy and self-esteem. And so there are multiple reasons unique to patients with epilepsy that they can have difficulties with self-esteem, and particularly in young men and adolescents. It's a time of hormonal changes, and people are particularly self-conscious, and we see that men with epilepsy in their teen years can have some difficulties with positive self-esteem. And so this may be secondary to difficulties forming relationship with others, either because of seizure worry or because of social isolation. You know, we see that for multiple reasons, people with epilepsy can become socially isolated, whether it's because you can't drive or because you're not working. And so from a psychological perspective, social interaction is a vital part of healthy aging and mental health. Something else that we notice that sometimes happens in our patients with epilepsy is that depending on the severity of epilepsy, the family, as they should, tend to rally around the patient and protect them. And what happens sometimes if somebody's developed epilepsy as a child, over the course of their lifetime, this becomes ingrained in the family unit, and the independence or the tendency to go out and do things independently is less. And so, you know, knowledge is power, and being aware of this tendency is quite important. Another factor that can impact epilepsy and self-esteem is perceived stigma. I think it's very clear that the popular media has one perception of epilepsy, and everybody else in this room has a very different perception of epilepsy. And those two do not collide. And so, you know, what people expect from people with epilepsy is very different, and we can feel that. So whether you're fearing being judged or you're perceiving discrimination, those things can affect our self-esteem. And there's something called internalized stigma, which is essentially that we cognitively or emotionally absorb the assumptions and stereotypes of others and then come to believe them ourselves. And so that's quite common in chronic illness, but particularly in epilepsy, because there are sometimes outward manifestations of illness, and we have fear of being in public. And so what we know protects us from internalized stigma is our quality of life. We're going to talk about how to improve your quality of life. Things like depression and our mood can also worsen internalized stigma. Now, in terms of what's most protective is knowledge of epilepsy. So you're all here doing the right thing, learning about epilepsy, which is in and of itself protective. Social support and family support is also quite important, and a sense of self-efficacy and achievement. And so when we talk about depression, the two things I tell patients the first time I see them is that you have to get activated, get moving, and then feel a sense of mastery and a sense of pleasure. Do something where you're achieving, even if it's small things. You're making a list and you're crossing 3 things off, and you feel like you've gotten something done today, and doing enjoyable things. You know, when other things are impacting our lives and the bills are due and we're staying up late and we're at work late, all these things that are, you know, normal stressors in our life, we can forget to do the things that are most important for our mental health, like a sense of mastery and pleasure. You know, other things that can impact self-esteem in terms of epilepsy are frank discrimination, the loss of independence that comes from epilepsy in certain cases. One thing specific to men is the potential role shift that men can experience. Men are often see themselves as the breadwinner and the primary protector of the family, and in some cases this can be challenged when you're no longer able to work or you can't drive. And so those are factors that are part of epilepsy that we have to face head on. And then finally, another potential factor is medication side effects. And so, we've talked with Dr. Gutierrez about the potential medication side effects and weight loss and weight gain and hair loss, all of these things which in all people can affect how we perceive ourselves. And then emotional factors. So we know certain medications like Keppra can make us more irritable, and those medication side effects have a more pervasive theme. So what's the effect of low self-esteem? What the literature shows is that while patients aren't necessarily depressed, they express general life dissatisfaction, sexual problems, which we've already talked about, and mood disorders. And so before we talk about ways to improve self-esteem, I just want to focus briefly on mood as a primary factor, because what we know in terms of quality of life is that your mood state, your depression and anxiety, is the best predictor of your quality of life. So regardless of seizure control, your mood and how you're feeling on a daily basis really helps us to determine how you are enjoying your life. And so all of these factors contribute to quality of life, including your perception of your health and your understanding of your disease, physical functioning, any limitations you have, and then things like driving and social support. So when we talk about depression, essentially major depression is characterized by primary sadness and a loss of enjoyment or pleasure in activities, as well as any of these other features, including sensations of worthlessness or guilt, obviously suicidality, any changes in your sleep. Depression manifests in multiple ways, and so it manifests cognitively by things like worrying and telling ourselves thoughts about ourselves that are negative, but also affectively in the way that we're perceived. I think all of us, if you've had any interaction with somebody who's depressed, they look different. They're not smiling, their face isn't as bright, they're not emoting as much, and that's a signal to us for depression. And then finally, more of the physiological manifestations of depression, things like weight loss or weight gain, changes in sleep, excessive fatigue. All of those things are features of depression, and if you're having them and they're starting to be debilitating on a daily basis, it's really important to talk to your doctor. What we know is that in epilepsy specifically, what we tend to see is a dysthymic presentation of depression that's characterized by depressed mood, irritability, and anhedonia. And so it's in many ways a lower level form of depression, but it can impact your life and is debilitating and should be addressed. And so, in comparison to the general population, there are significantly greater rates of depression, anxiety, and suicidality. And so knowledge is power. We know this, and if it's something that's affecting you on a daily basis, it's really crucial that you reach out to your doctor. And in terms of mood and epilepsy, this is bidirectional. It's not simply that you're depressed because of your diagnosis. There are organic brain interactions that make you more susceptible to depression, depending on your epilepsy type. And so what do we do about mood disorders? Medication is effective. The gold standard for depression treatment is medication and psychotherapy. And there are multiple forms of psychotherapy. Psychotherapy is no longer sitting on a couch and talking about your childhood. Most empirically validated psychotherapeutic modalities at this point are problem solving and action focused. And so you'll go in, decide with your therapist what's wrong, and then do something about it. Put very simply. The most validated form of treatment is cognitive behavioral therapy. And what cognitive behavioral therapy focuses on is essentially two things. So like I said before, behavioral activation. Are you getting out of the house every day? Are you getting up every morning at the same time? Are you doing things to interact mentally, socially, and intellectually? And then the second part of it is looking at the thoughts we tell ourselves. Everybody has automatic thoughts that pop across their head every day, and some of those are valid and adaptive, and others are not. And when you are in a period of depression, more likely than not, those thoughts aren't valid or adaptive. And so, for example, when I walked by Dr. Sperling today, if he hadn't said hello to me, I could have interpreted that in multiple ways. And the things that I tell myself affect how I'm going to feel. So I could have said, oh, he didn't say hello to me, I must be in trouble with the boss, it's because I'm terrible, I can't do anything right. So now if I'm telling myself those thoughts, I'm not going to feel very good about myself. Now if I'm telling myself something to the effect of, oh, he's busy, it looks like he must be running late, the emotions attached to that experience are very different. And so it's really important to recognize that, particularly in periods of depression and anxiety, sometimes our brain plays tricks on ourselves. Everybody has automatic thoughts that pop in and out all day. Plenty are useful and plenty are not. I'm sure lots of you are thinking about lunch and getting outside today, and that's useful, and I'm working on it. But, cognitive behavioral therapy is essentially a way of evaluating those thoughts, okay? Now, a different form of therapy is acceptance and commitment therapy, and this is a shift in paradigm, because instead of asking us to evaluate and then change our thoughts, it really is focused on identifying our thoughts, accepting them, and moving on. And what I tell my patients is that usually this is better for patients who are psychologically oriented and enjoy metaphors. There's a lot of metaphors in this therapy. And so if you're somebody who tends to think a lot about your mental health and your functioning within your family, then this is the therapy for you. And then one final form of therapy that I'll just focus on quickly that is getting increasingly more popular is mindfulness and mindfulness-based stress reduction. And so essentially, mindfulness focuses on reverting your attention. As humans, our brains are designed to constantly filter out information. And so, because I'm trying to focus, I'm not noticing that roar of the whatever that is. And so I'm not noticing that somebody might be playing with a paperclip. I'm not noticing what's happening in the room next door because my brain is working with me to focus. But that takes a lot of energy. And what the literature tells us is that reorienting our attention to just be with ourselves and recognize our bodily sensations and our perceptions of our environment can have a positive impact on the brain. And so think about that. Just learning something that is very similar to meditation can impact and change areas of our brain. And so all of these things are ways to treat mood disorders. There's also biofeedback, which is another way of essentially measuring your physical reactivity. So whether it be through, in children with ADHD, they often have them hook up to an EEG, which everyone's familiar with, and skin conductance. And they learn how their breathing and their focus can change those things. And again, that's all about our attention refocusing. And then, community support. You're all here, and so you're engaged in community support, but the more, the better. So to revisit self-esteem, how do you improve self-esteem? This is easy said, hard done. And so first and foremost, and this should be the take-home message today, is that adequate seizure control is a good predictor of improved self-esteem, improved depression and anxiety, and improved sexual functioning. The Epilepsy Foundation offers amazing support groups, and I encourage you to take advantage of them. Stress management in whatever form that means for you. If you're somebody who doesn't find breathing exercises and meditation something that you're in line with, then what do you do for stress? Everybody in this room has different coping mechanisms. whether it's reading or exercising or talking to a loved one. The important part here is be cognizant of what works for you in terms of stress management and then do it on a daily basis. Life can get in the way of our ability to maintain our mental health, and it's important to make it a priority. Exercise is crucial, not only for mental health, but there are indications that it reduces your risk for sexual dysfunction. Basic lifestyle changes that have been parroted today, things like smoking cessation, reduced alcohol use, living a healthy lifestyle helps us both in terms of sexual functioning, self-esteem, and mood. Education, learning about epilepsy and learning about ways to improve sexual functioning, and identify your triggers. One thing that I'll talk on briefly is that the epilepsy disorder itself can sometimes leave us with a sense that we're not in control. Just by definition, right? We can't do very much to mediate our seizures. They come on unpredictably and we can't control them. And so that sense of lack of control can be pervasive, and we can start to incorporate that in other parts of our life. And so it's really important for our patients with epilepsy to focus on what you can control. What can you do to manage your disease? What can you do to manage your sense of mastery and pleasure? And one thing that I'll conclude with is that there is good, empirically validated evidence now that the art therapy program offered by Studio E through the Epilepsy Foundation is an excellent way to improve self-esteem. And so that program, I'm sure others here would be better able to talk about it, but I think I did see a handout on the desk. But essentially, over 8 weeks, patients went in for 3-hour sessions of painting or sculpture, whatever that really drew their interest. And what they saw is that after 8 weeks, so this is not years, 8 weeks, you can do anything for 8 weeks. After 8 weeks, their sense of self-esteem skyrocketed. We don't see effect sizes that high very often. And so, whether it be specific to art therapy or really the fact of the matter is that, doing something for yourself and having a sense of pleasure and mastery is more important. You can find whatever your niche is. What do you like to do, and how do you plan to incorporate it into your daily life? And so, in conclusion, I think I'm getting out to the sun a little early, but I think that's okay. Men are faced with unique and gender-specific challenges related to sexual health, mood, and self-image. And the most important thing here is talk to your doctor. Even if you're finding it embarrassing or a taboo thing to talk about, they're ready for that conversation, and they will have suggestions. People with epilepsy are at an increased risk for sexual dysfunction, and so that can either be related to seizure activity on the brain, medication side effects, or these biopsychosocial factors that we've talked about. What we know is that it's important to control your seizures to the best of your ability. You will see positive improvements in both mood and sexual health. And most importantly, there's a lot you can do. That one slide that I showed you that has all the risk factors for erectile dysfunction, only 3 of them are epilepsy related. The other 15 are things that you can do today. And so I'll thank you for your attention.